Dr. Petti, let me ask you about periodontal disease.
Okay.
I know, actually, let's talk about there is gingivitis, there's periodontitis, there's gum disease, there's periodontitis. I mean, is it all the same? Is it something different? Give us the different stages and tell us what those names all mean to us.
Okay, so you want the stuff in plain English. Absolutely.
I want it in, I don't understand English so well. I want it in a way I can understand it.
Okay, so, all right, well, that sounds good. Gum and bone disease is probably the most prevalent disease that adults will have. I believe the figure is anywhere from up to about 75% of all adults will have some form of gum and bone disease. So what does that mean? Okay, it means that the tissue and the bone surrounding and holding the teeth in, because you have the tooth itself, now you have your gum tissue and your bone holding it in, that means there's something going south on it, something going wrong. And it needs to be handled, because if it's not handled, it will continue to disintegrate, it will continue to inflame, it will continue to lose bone around the teeth, and then the next thing you know, you have full-blown periodontal, which periodontal refers to around the tooth, meaning gum and bone. You'll have full-blown periodontal disease, bone loss, tooth loss. So in our practice, the best way for determining gum and bone disease is what is known as a full periodontal evaluation. And we do that with every new patient. We take reads, 6 reads, depth reads with a millimeter gauge around each and every tooth. And by the way, this is a flexible plastic gauge. You don't even know that it's happening. And compare it to the norm, or what it's supposed to be. To give you an example, the normal read around a tissue is supposed to be either 1, 2, or 3 millimeters, meaning that particular depth. And by the way, it doesn't matter if they're all 1 millimeter or all 3 millimeters. That range is a normal, healthy depth of tissue around the teeth themselves. Also, when you're probing in their helmet, that tissue should never bleed, all right? And when I'm talking about probing, I'm probing gently, putting about maybe 2 ounces of force in there. So if a person has all 1s, 2s, and 3s, and no bleeding, and their tissue's pink in color, firm in nature, meaning firm against the teeth, and knife-like. Knife-like just means it looks like, on the Halloween pumpkin when you carve it nice and crisp around in there. It just has a very nice, firm knife-like texture to it. That's healthy gum and bone.
And when you say tissue, sorry to interrupt you, when you say tissue, you mean the gums?
I mean the gum tissue. That's exactly what I'm talking about, the gum tissue. When you start to get deeper reads, 4s, 5s, 6s, or you start to get bleeding in there, even if they're 1s, 2s, and 3s, that means you've got some problems, all right? Because bleeding on any other part of the body, stop and think about this, helmet, be totally unacceptable. I mean, if your nose was bleeding right now, or you're bleeding from your ear, you'd probably be a little concerned about it. So people should be just as concerned if they're bleeding from their gum tissue when either they're brushing or they're flossing. The first type of problem that people will have is called gingivitis. The gingiva is basically what is referred to as the gum tissue. So think of gum tissue, gingiva, all right? If itis means inflamed, so if it's inflamed, you have gingivitis, which means the tissue will look a little red, and when we're probing in there, well, you're going to get some areas that are going to bleed very easily on probing. They still may be 1s, 2s, and 3s, but that bleeding is not supposed to be there. And that's what gingivitis is. When you move into the next stage of it, called periodontitis, that means the perio, which is around the teeth, the bone is actually disintegrating. So now your gingivitis has turned into bone loss. And a lot of times you'll get reads on the probes of 4s, 5s, 6s, 7s. I mean, there can be so much bone loss that it sinks all the way up to the hub of the measuring instrument, which is about 12 millimeters. And the basic infection that's been going on in your mouth has made its way down into the bone, and it's eating away the jaw bones of the face. It's really that simple. And so that kind of defines hopefully that defines the terms in understandable language that the people will have in there. Now, here's how it comes to pass. plaque that builds up on your teeth 24/7. It's always there. And plaque is nothing more than a colony of bacteria. It's bacteria kind of having a party and a field day with other bacteria. It sticks to the surfaces of the teeth. Okay? Your brushing and your flossing, if done correctly on a daily basis, should be able to adequately remove this. But if people aren't good about that, then the plaque starts to build up on that. And the first thing people will see will plaque with some stain, and they'll see that tissue get a little bit red. Once the plaque settles and starts to make a home below the gum line, then that's when all hell breaks loose, because that bacteria becomes mineralized below the gum line. And when I'm talking mineralized, I'm talking like barnacles on the bottom of the boat. I don't care how much you scrub, how much you use floss in there. If it's not mechanically removed, get the idea that that stuff is going to do damage. Now you have a mineralized colony of bacteria. It's feeding off of the saliva in your mouth, and the byproduct, basically think of this as the waste product of that, is acid and stench. And so what it does is it starts to eat away the gum tissue, inflame the gum tissue, and eat away the jawbones. All right? And then it builds more and more and more bacteria down in there. And when it reaches the part or reaches the stage where it hurts, then a lot of times that's too late for some of the teeth. So this is a disease that gradiently progresses. And in the first stages, you're not going to notice anything as far as discomfort or pain. The first thing that people usually notice is, hey, when I'm brushing in there a lot of times, Doc, or when I'm flossing, I'm getting some bleeding in here. Telltale sign that things are going south.
Well, it looks like, so basically what you, as this whole bacteria, this colony of bacteria builds up under your gums and between your gum and gets further and further down, so that's like having chicken and rotten eggs under your carpet and leaving it there, and you wonder why it starts stinking and all kinds of stuff.
Oh, exactly. Exactly. Think of the, someone told me the other day, or I read the other day that, bacteria, and bacteria is going to be in the mouth because it's friendly. A lot of it's friendly for your digestive and your stomach and all of that good stuff. So it's supposed to be there. You're never going to totally eliminate it. But it's basically the same product that comes out of the bacteria is the same waste product that comes out of us, and that smelly waste product. And that's lovely to think of, but it's the truth. That smelly waste product is making a home underneath people's gum tissue. So, it's not pleasant. It stinks. It eats away the bones of the face. And many, many times, if caught in the early stages, Helmut, it's an easily controllable situation. And the patients, it's amazing how well that can heal.
Yeah. And, as you talk here, number one, we know that you don't want to have a bone loss and you don't want to have a tooth loss because you start looking ugly. Frankly, to me, that means more than losing your teeth and maybe not chewing your food perfectly. And yes, you can fix all that. You can put implants in it, but who wants to spend thousands of dollars on an implant if you can go on vacation for it, right?
Absolutely.
Yeah. However, it looks to me like something else. I know that for many reasons that the mouth seems to be an enormous open gateway, a doorway to the blood vessels, because take salt or take certain things under your tongue and it goes right into your blood vessels and you get energetic again or whatever it means, whatever you're taking, right?
Absolutely.
So if you have an infection in your mouth, it means the same. It travels into your blood the fastest, faster than if you have that yellow, ugly, reddish pus in your little finger, versus if you have it here, it can travel to the brain very fast and to the heart very fast.
Yes, absolutely. The mouth is very vascular. It's got a lot of blood. It's got a lot of blood vessels in it, and that infection will pick up. Just like an infection, just like in an open wound, an infection can pick up any place else. So if you have an open wound on your hand or your foot, you certainly don't want. You fix it. You don't want infectious bacteria in there. Believe me, you don't want that. You'll know about that in a heartbeat.
And it's a lot longer to travel from an infection from your finger to up here and to the liver and to the kidney than from in here, right?
Right, exactly. In the mouth, it just has a great, as you put it, a great gateway to get into the system right away, because with the periodontal disease, don't forget, the first sign is inflammation. That means those blood vessels are open and bleeding. And that means it just has a great gateway to get into the system. Where it goes from there, it can travel to the brain, it can travel to the heart. It's not pleasant. It's basically just keeping that under control so that infection can't manifest itself in other parts of the body. You don't want that. At least I don't think people want that.
Well, Dr. Petti, I have to cut this interview a little bit short. I have to go to my dentist.
There you go. You better get checked out, Helmut. Make sure.
I have to go. I don't want it. I can't stand this anymore. I got to get my infections out of my mouth.
You got it, pal.
Well, all right. Bye-bye.
I'll see you, Helmut. Take care.